and you may know people who are in this photo book. So Ian Ross Pettigrew is a photographer from Canada who did this expose on women with CF, and it's really a body positive project that he was working on. But it also, for me, really makes me think about, what are the reproductive goals of our young women with CF? And when we did our survey, we did ask them that. And we found that 78% of young women with CF that we surveyed intended to have future children. So as the age of our population and as of people with CF rises, their expectations for their sexual and reproductive health future is also changing and becoming, very similar to their peers without CF. So as I said, my focus in research is really on this, which is how are we talking about all these issues with our female patients with CF, and how are our patients and our women with CF talking with their providers, or are they? So I did a couple of things to start to think about this. Because I didn't really know what was going on, I knew what my experience was with my patients, but I didn't really know anything else, is I started pretty humbly and I started actually talking to people. And we found four main themes when I interviewed women with CF ages 18 to 30 and then CF center directors from around the country. Everybody kind of agreed that sexual and reproductive health is important to discuss in the CF care setting. And I'm going to highlight some of these with some quotes. So this is a patient talking, and she said to me, "It's always just like you don't talk about it. It's one of those things that's left to the side. It's like they feel as if it's not as important as everything else, but sometimes it is. I mean, sexual and reproductive health wasn't life or death threatening, but it could have changed my life a lot." The second thing that I found out of the interviews was that patient and providers are all uncomfortable around this, and that's a major barrier to care. A provider said, "You do what you're comfortable with. I'm not good at fielding questions about sexuality, so I probably don't bring it up as often as I should." And then this is my favorite quote. A young woman said to me, "I don't think they think about vaginas. I just think they like to think about lungs." The third thing that came out is that educational resources, but coupled with standardized provider discussions, would help with providing this type of care. As a provider said to me, "This is just part of the issues that need to be addressed with regularity, so regularity becomes familiarity." And then finally, the women with CF that I interviewed preferred early, open-minded discussions around sexual and reproductive health initiated by the CF team. So honestly, start discussions young and have it be an expectation. We walk in here and know that people are going to talk to us about bowel movements. It's just part of what we know is going to be asked. So start at a young age and it becomes part of the routine. So from here, I really wanted to see, I kind of got a sense of what was going on and what this small group was telling me. But I wanted to survey providers about how they think about this and what they do. So we started with a survey of CF physicians, physician's assistants, and nurse practitioners, both pediatric and adult. And we found that they all really did, the majority felt that this was important for female patients with CF, and it should be standardized in the CF care model. 40% of this group felt that the CF team should have the primary role in sexual and reproductive health care. But there were major discrepancies between how important providers felt these topics were to discuss and how often they actually did it. And so I'm going to go through some of these numbers. So these are the topics that I asked about. I asked about, everything from puberty to pregnancy planning. As I said, I'm a pediatrician, so this is skewed a little. And this is how important they rated these things. These are the percentages of people who felt that these were important or very important to discuss. And these are the percentage who said they actually talked about it at least once a year. So you can see there's big discrepancies. So 56% of people felt that sexual functioning was important to bring up. Only 36% reported actually talking about it. STIs, you can see some of the similar numbers, and then pregnancy planning, you could see the discrepancy there. This gets much more interesting when you split the providers into pediatric versus adults. The same topics here, And then this is the percent of pediatric physicians who felt this was an important topic. And this is the percent of adult physicians that felt it was important. And then you're going to see that pediatric physicians were less likely to feel urinary incontinence was important, sexual functioning, sexually transmitted infections, contraception, fertility, and pregnancy planning. In thinking about what they're actually doing, so this is percent of pediatric providers who brought it up at least once a year. This is the percent of adults. No surprise, adult providers don't bring up puberty. There's no need to. But pediatric providers were, again, less likely to bring up urinary incontinence, yeast infections, sexual functioning, STIs, contraception, fertility, and pregnancy planning. And I just want to remind everybody that just because you're less than 18 years old does not mean that you're not experiencing things like urinary incontinence and yeast infections, and does not mean you're not sexually active. And a lot of pediatric providers are really taking care of patients into their 20s until they transition. So there's definitely a gap in care that we're seeing. The other important thing that I wanted to see was, okay, this is what providers said they were doing, but what are patients really experiencing? So this is from the survey that we did of the 15 to 24-year-old young women. And I basically had the same topics there, and I asked them, have you ever had any discussion on this topic in the CF care setting at any point? And you could see the numbers here. So the most common thing that they said somebody had brought up with them at some point was puberty or their period, so 72%. The rest of these numbers are bad. Only 14% had ever been talked to about urinary incontinence, 30% about yeast infections, 36% about their relationships, 11% about sexual orientation, 3% about sexual functioning, 17% about STIs, a little over a third about birth control and sexual activity, 4 had been talked to about fertility or planning for pregnancy. That's kind of what they had experienced in the care setting. And then I wanted to see, how is this translating? So we're not talking about it. Are they actually getting sexual and reproductive health care? And we found that they were 9% of women with CF that we surveyed had ever received counseling around birth control, ever, compared to 26% of the general population in the past 12 months. And these general population data are from national surveys that are put out. Women with CF were also significantly less likely to receive pap smears or pelvic exams. And this is adjusted for age and race. So they're almost 20% less likely to get a pap smear or pelvic exam. And they're much less likely to undergo pregnancy testing. To really check on how things were going with parents as well as younger patients, and I'm not going to focus on this, I wanted to see how they were learning about sex. And I did interviews with parents of teenage women with CF, and I did interviews with teenage women with CF. And I found a couple things. First off, CF-specific sexual and reproductive health education is generous. Almost non-existent. So what we found out was parents or schools did talk about sexual and reproductive health, but it usually didn't include CF at all. And there was very rare discussion of this with any of their healthcare providers. When we talked about, why this is happening, parents had said that there was this fear of bringing up these issues with their teenage daughters. There was a real lack of knowledge regarding the sexual and reproductive health issues that were facing their children. And both parents and teenagers said, I don't know who's in charge of this. Like, whose job is it to bring this up? Is it the CF provider? Is it my pediatrician? And I just want to call this out because I'm going to talk a little bit more about this in a second. But this is the quote. The pediatrician talked about sexual and reproductive health. But anything to do with CF, it's always, I don't know, you need to talk to your CF doctor. And then when we're here in the CF clinic, we've asked questions that weren't directly CF related. And the CF provider has said, you really should talk to her pediatrician about it. So there's this space between the two. So what's the problem? Why aren't we as a CF team bringing this up? So when I interviewed CF center directors, they came up with a bunch of barriers, but these were the big ones. One is we don't have enough time in clinic to talk about these things. Two is we're uncomfortable and we think our patients are uncomfortable too. And three is we are not knowledgeable or we do not have expertise around sexual and reproductive health, so we don't bring it up. But again, I come back to kind of what patients want. So this is from the first interview study I did, and I come back to it all the time, is that patients said they wanted educational resources, but that wasn't enough. They wanted to talk about these issues that are CF specific around sexual and reproductive health with their CF providers. And this is not the first time that this model has been brought up. So Doctors Freeman and Sawyer came up with basically a plan for how to deliver sexual and reproductive health care to men and women with CF across the life course. So they started in puberty and went all the way through menopause and beyond. And they really saw the CF team as the broker or the key educator for this type of care, to really start talking about these issues at birth with parents and starting at puberty with patients, or even before if younger patients were experiencing yeast infections, urinary incontinence, those kind of things. And really to kind of broker care to the women's health specialists or men's health specialists in the model and the primary care doctor. When I had asked in the survey and in interviews, I really did find that the majority of young women with CF do agree with this model, that the CF care team should take the lead. But the CF care team is big. This is a graphic right from the CF Foundation. These are the required team members on the team, so nurses, dietitians, doctors, social workers, respiratory therapists, and a program coordinator. But you also might have physical therapists, psychologists, research coordinators, and pharmacists on your team as well. And I have asked who should be in charge of doing this on the CF team so many times. And in the survey that we did of 15 to 24-year-olds, 83% of those people preferred to have these discussions with their primary CF provider. So their physician, their nurse practitioner, or their physician's assistant. 24% with the CF nurse and 19% with the social worker, and then less so for the other disciplines. But when I've done interviews with teenagers, with parents, with adults, it really comes down to this. So this is really patient dependent, and it probably varies. And especially because sexual and reproductive health is and can be a very sensitive aspect of your care, the woman with CF should have the control to decide with whom she should be talking about these things with. We also, in the same survey, found that 62% of the women surveyed thought that the CF team should be the ones to start the conversation, and 33% thought it should be the woman. And again, this is with teenagers and young adults, so it may be skewed if you think about fully adult patients. 75% of the group felt that family and partners should be completely out of the room for these topics, unless the patient wished that they should be there. But this is, again, not a simple thing. When I did the first interviews that I talked about with the patients and the providers, I talked about a bunch of issues I talked about with patients. I talked about puberty, I talked about urinary incontinence. But when I got to pregnancy and parenthood decisions, the conversations were so rich and there was so much going on that we had to split out all of that data and do a whole separate paper on it, because reproductive decision making is very complex for women with CF. And we really found that CF is what women were naming as their number one consideration when they were deciding their reproductive goals. Obviously not everyone with CF feels that way, but that was a big theme that came out of the interviews that we did. Also, in thinking about reproductive goals, a lot of the women that we were talking to and what we found is that they really valued a partnership with their team, and open, honest, and efficient communication is really, really key. In the primary care setting, so outside of CF, there's this idea of one question. So if you're a general internal medicine doctor and you have a woman of childbearing age sitting in front of you, asking this question can open the conversation. So would you like to become pregnant in the next year? If they say yes, you go down that pathway of making sure they're healthy and, are set up with care and have thought through things and all the things. If they say no, you can ask if they're sexually active, if they have a partner, all the things. And, if they don't want to become pregnant, going down the road of birth control. I think that this question is good, but I would argue that this is a better question for CF because there are multiple options for becoming a parent. And I think that this is a better question. Would you like to become a parent in the next year? And kind of using that as an open statement. But I think one of the main questions that I'm going to really want your feedback on and want to leave you with is this right? People have said that the CF team should be the lead and should broker this care. And I think that can work, but you really need a CF team that's invested and involved and able to do this. There's other models that you can think of. You can think of an equal role of the CF team, a women's health specialist in primary care, where we're all working together. I think that this really relies on a couple things. One is that you have a primary care physician who you actually go to see. I think that a lot of people with CF see their CF team so often that primary care is often left to the side because who has time to do all of that too. And it also relies on the idea that women's health specialists in your primary care doc are going to understand the very CF specific issues around sexual and reproductive health that women with CF face. And then this is the idea that the CF team would partner with a women's health specialist, just kind of like the CF team partners with GI specialists or endocrine specialists, where they're part of the team and embedded in the team and working together to provide this care. The other model that I think about with this too is mental health coordinators and at times psychologists are now embedded into the team and are providing mental health care. So I think that this is another model to think about. And I constantly question, because I think that a lot of people have said this is the way to go. The CF team is the lead. We see them all the time. We should own this. It's our responsibility. If you see somebody every 3 months, it should be you. But I think that because of the barriers that there are around the CF team's comfort and ability to deal with these things, this is one of my main questions. And if it is going to be the CF team, how do we make CF providers feel comfortable in addressing these things, and how do we make it easier? And then how do we empower patients and women with CF to be able to talk about sexual and reproductive health and just bring it up as, this is a very key aspect to our care. So, I referenced the survey that we did of 15 to 24-year-old women, of which none of you fits into that age range. But I do encourage you to stay tuned. There's a 10-site survey of women with CF and their partners, of women who are 25 years and up, that we're going to probably start enrolling within the next 2 months or so. Same idea. We want to get a sense of what the sexual and reproductive health issues are that this adult women with CF face, and then what their preferences are and how they want to receive their care. And then the second thing that we're working on is these decision aids for understanding and eliciting people's reproductive goals and their birth control choices. And so I'm going to talk about that just a little bit. My path is this idea of a reproductive goals decision aid. It's set out of the Veterans Administration, so VA Health. But you basically log on to this website and they say, our goal is to take care of you as a whole person. For many people, pregnancy and birth control decisions are an important part of their whole health. Depending on your needs, this tool, My Path, will help you make informed decisions by giving you the chance to consider how you feel about having kids, get info about your menstrual cycle and fertility, learn how to be prepared for a healthy pregnancy, and find birth control. Once you get into this tool, you can, answer questions about your thoughts, go through all of these menu items to help you think about this. And the thought is that we would take a tool like this and really develop it for women with CF. And not just thoughts about pregnancy and children, but thoughts about parenthood, and really embedding in there cystic fibrosis specific information, things to consider, drugs to watch out for, all those things that often people have questions about. As part of this tool, there's also a decision aid around what, if you don't want to become pregnant and you're having sex, what birth control should you pick? What method is right for you? If you go to this website that I have here, this is one for the general population where you can go and it talks about your priorities, about how effective you want it to be, how easy you want it to be to take, all those things. And it helps you pick a method, but really making this CF specific. So if you're on a modulator and you can't use certain forms, if you have, a port in place and you shouldn't use specific forms of birth control, like allowing this decision aid to help you think through, okay, these are my CF specific things I have to consider, as well as, my personal priorities around birth control. So that's kind of what I'm working on the survey, as I said, for adult women, but also these decision aids. And again, the point of these is not that your provider would just hand you this website or app and say, like, go to it, figure it out, but really that they would hand it to you. You could take your time, think about it, go through the tool, and then take a summary sheet or take what you've learned from it back to your provider, both your CF provider and also, a women's health provider, and say, like, okay, these are the things that the tool helped me think about. These are the questions that I had as I went through it, and use it as a true decision aid and a communication tool, not just something that we hand to you and we say, like, okay, see ya, good luck. So that's kind of where we're thinking about at this point, where we're working on going. And I'd love your feedback on anything you have to think about that. But I did want to stop and thank everybody. So this is Julie Child. Literally everybody who's ever seen me talk gets to see the slide. This is her when she is on her cooking show. And as you can see, there's lots of helpers behind the scene. And these are my helpers behind my scene. Lots of folks from Pittsburgh, lots of folks from Boston. The Cystic Fibrosis Foundation has consistently funded me. And then CFReSH has been an unbelievable source of enthusiastic support and expertise around refocusing and continuing to refine what I study. And I will say specifically a thank you to Molly, because that whole bit about reproductive decision aids and how we're going to do that work completely stemmed from Molly saying, wait, I think that this is something that is important that we address, and this is something that we need to think about. So I really took that and I said, okay, I could rethink what we're going to do and really change what I was going to focus on researching, and really listening to you guys in what is important to you and focusing on that, not instead, but also just retooling a little bit. So I'm going to stop there. I don't know if you guys have questions for me or anything, but I again, I'm so happy that I got to talk about this with you today.